Welcome to our YouTube channel. Today, we're diving into the fascinating world of medical diagnostics, specifically focusing on the anti-mitochondrial antibody M2 EIA test. Ever wondered how doctors diagnose certain autoimmune diseases affecting the liver? Well, you're about to find out. Pre-test information. No special preparation required. Before we delve into the specifics of the anti-mitochondrial antibody M2 EIA test, let's talk about what you need to know beforehand. The beauty of this test lies in its simplicity. No special preparation is required. That means no fasting or dietary restrictions before undergoing this test, making it accessible and convenient for patients. Disease-associated. Diagnosing primary biliary cirrhosis. The primary purpose of the anti-mitochondrial antibody M2 EIA test is to diagnose primary biliary cirrhosis, also known as primary biliary cholangitis. This autoimmune disease wreaks havoc on the liver, causing inflammation and scarring of the bile ducts. PBC is a chronic progressive condition that predominantly affects women between the ages of 35 to 60 years. Early detection of PBC is crucial for timely intervention and management, making the anti-mitochondrial antibody M2 EIA test an invaluable tool in the arsenal of healthcare professionals. Specimen used. Blood sample collection. Now, let's talk about the specimen used for this test. Typically, a small sample of blood is collected from the patient. This blood sample is then subjected to analysis to detect the presence of anti-mitochondrial antibodies targeting the M2 antigen. Components include essential components of the test kit. The anti-mitochondrial antibody M2 EIA test kit contains all the necessary reagents for the enzyme-linked immunosorbent assay procedure. These components play a crucial role in detecting the presence of anti-mitochondrial antibodies in the patient's blood sample. From specialized antibodies to substrates and buffers, each component is meticulously selected to ensure accurate and reliable results. Test report time. Turnaround time for results. One burning question on everyone's mind is, how long do I have to wait for my test results? The test report time for the anti-mitochondrial antibody M2 EIA test can vary depending on the laboratory's workload. However, patients typically receive their results within a few days. This turnaround time allows healthcare providers to swiftly formulate treatment plans and provide patients with much-needed peace of mind. Test information. Significance of detecting anti-mitochondrial antibodies. As mentioned earlier, the anti-mitochondrial antibody M2 EIA test specifically targets the M2 antigen. Out of the 9 types of anti-mitochondrial antibodies, M2 and M9 are the most likely to cause clinically significant illness, with M2 being the most specific for PBC. By detecting the presence of anti-mitochondrial antibodies targeting the M2 antigen, doctors can aid in the diagnosis of primary biliary cirrhosis. Moreover, early detection of anti-mitochondrial antibodies can also help in monitoring disease progression and response to treatment, ultimately improving patient outcomes. Conclusion. Wrapping up, understanding the AMA-M2 EIA test. And there you have it, a comprehensive breakdown of the anti-mitochondrial antibody M2 EIA test. If you found this information valuable, don't forget to like, share, and subscribe for more insightful content on medical diagnostics and healthcare. Thank you for joining us today, and we look forward to seeing you in our next video.